We have some central nervous system tests like the psychiatric test or the neurocognitive test. Now, in order to assess a patient's degree of intelligence, we resort to like psychological tests like Wechsler's test and all these tests. Now, what happens here is many things need to be considered. Is the test being administered by the doctor, or is the test being administered by the technician, or is the test being administered by the computer? Finally, what happens is interpretation and report would be provided by the physician. So here you can differentiate the technical services from the professional services. If all of these are being done, you can also report them together, and you can also count the number of tests that are being done separately. You can report that also in various units. Here, how it operates is that you need to know the type of psychological tests, and based on that, person who is administering and then what is the interpretation, we can figure out whether it is you need to assign modifier 26 or TC. You don't sometimes have to assign them because the code itself would be of a professional and a technical character. Coming to neurostimulators, we have already seen what are neurostimulators. These are in fact neuromodulators for pain management. Here again, we have discussed various types of stimulators as intracranial stimulators and the spinal stimulators and the peripheral stimulators. So accordingly, we can also further classify them as simple neurostimulator and a complex neurostimulator, because you remember what happens is electrical current or the discharge sets in from the electrodes to the affected nerve, so that what happens is as the electric current passes, now the pain signals are just being modulated so that the patient does not feel the pain, right? So here you should understand the pulse frequency, the pulse duration, the amplitude, the rate, and the cycles and all that we would say, right? So if up to 3 parameters are studied, we would take them as a simple neurostimulator. If more than 3 parameters are studied, we can take that as a complex neurostimulator. We have separate codes for intracranial, spinal, and the peripheral. So you can select the appropriate codes based on the programming that is being done.